Over 60? Cancer could be hiding in these 8 symptoms you think are harmless. There's a dangerous truth that most people over 60 will never hear from their doctors. Every day, thousands of seniors dismiss warning signs thinking they're just part of getting older. But what if I told you that those harmless aches, that persistent cough, or that unusual fatigue could actually be your body's desperate cry for help? New research reveals that up to 67% of cancers in people over 60 are caught in advanced stages simply because the early symptoms were ignored or misdiagnosed as normal aging. And shockingly, 89% of seniors have no idea that their body's already sending them warning signals months before a diagnosis. One symptom on our list, the number one that we'll reveal, is responsible for delaying cancer detection by an average of 8 months. And it's something 95% of people over 60 experience, but never connect to cancer. You won't hear this in most doctor visits. You won't see it highlighted in health magazines. But the science is crystal clear. And today, we're exposing it all. Symptom number 8, persistent heartburn. Persistent heartburn or indigestion. It sounds so common, so harmless. You ate something spicy, you're getting older. Your stomach just isn't what it used to be. But here's what no one tells you. Persistent heartburn, especially new heartburn that starts after age 60, can be an early sign of esophageal or stomach cancer. This isn't your typical after-dinner discomfort. We're talking about heartburn that happens regularly, doesn't respond well to over-the-counter medications like Tums or Pepcid, and seems to be getting worse over time. That's because as tumors develop in the esophagus or upper stomach, they can disrupt normal digestion and cause stomach acid to back up, creating that burning sensation you might dismiss as just heartburn. Here's the critical difference. Normal heartburn usually happens after eating spicy or acidic foods, drinking alcohol, or lying down after meals. Cancer-related heartburn often occurs at random times throughout the day, may wake you up at night, and progressively gets worse despite dietary changes or medications. The reason this happens is that growing tumors can narrow the esophagus or interfere with the stomach's normal acid production. Unlike typical heartburn that responds to antacids within 30 minutes, cancer-related heartburn often persists for hours and may be accompanied by a feeling of food getting stuck in your chest. If you're experiencing persistent pain that doesn't fit typical patterns, pain that moves around, is worse at night, doesn't respond to normal pain relievers, or is accompanied by other concerning symptoms like fatigue or weight loss, don't accept it's just arthritis as an explanation. Ask your doctor for blood tests to check for markers of bone involvement. And if the pain persists, request imaging studies like X-rays or bone scans. Remember, bone pain from cancer is often the first symptom that appears, sometimes months before other signs become obvious. Early detection can mean the difference between a treatable condition and advanced cancer that's much harder to manage. Symptom number 7, changes in bathroom habits. When people over 60 notice changes in their bowel movements or urination, the natural response is often embarrassment or assumption that it's just aging. But here's the uncomfortable truth. Significant changes in bathroom habits can be early warning signs of colorectal, prostate, bladder, or even ovarian cancers. We're not talking about occasional irregularity or needing to get up once during the night. We're talking about persistent changes that last more than 2 weeks. For bowel movements, this includes new chronic constipation, alternating diarrhea and constipation, pencil-thin stools, or any blood in your stool that you might dismiss as hemorrhoids. The science behind this is clear. Tumors in the colon or rectum can partially block the intestine, causing stool to become narrow as it passes through. They can also irritate the intestinal lining, causing bleeding that shows up as bright red blood or dark tarry stools. Even small amounts of blood that you can't see can be detected through simple stool tests. For urination changes, warning signs include difficulty starting or stopping the stream, frequent nighttime urination that's significantly increased from your normal pattern, a weak or interrupted flow, or the feeling that your bladder isn't completely empty. In women, persistent bloating that feels different from typical digestive issues, combined with urinary frequency, can signal ovarian cancer. The biological reason these changes occur is that cancers in the digestive or urinary systems interfere with normal function. Colon tumors can cause partial blockages, leading to constipation, or they can irritate the bowel lining, causing diarrhea. Prostate tumors can press against the urethra, making urination difficult. Ovarian tumors can press against the bladder, causing frequent urination and pelvic pressure. Your bathroom habits are one of the most important indicators of your internal health. Significant persistent changes after age 60 should never be ignored. Simple tests like a fecal occult blood test for colon issues, a PSA blood test for prostate health, or a pelvic ultrasound for women can catch problems early when they're most treatable. Symptom number 6, persistent fatigue. Persistent fatigue that doesn't improve with rest. It's probably the most universal complaint among people over 60. I'm just tired all the time, or I don't have the energy I used to have. Most people, and even some doctors, chalk this up to normal aging. But here's the truth that could save your life. Persistent, unexplained fatigue can be one of the earliest signs of blood cancers like leukemia or lymphoma, as well as solid tumors that consume your body's energy and nutrients. This isn't the tired feeling after a busy day or the need for an afternoon nap. We're talking about cancer-related fatigue, a deep, overwhelming exhaustion that makes simple tasks feel impossible, sleep that doesn't refresh you, and tiredness that persists even after a full night's rest. This type of fatigue is often accompanied by other subtle signs like frequent infections, easy bruising, or feeling short of breath during normal activities. The medical explanation is that many cancers affect your body's ability to produce healthy red blood cells, leading to anemia. Red blood cells carry oxygen throughout your body, so when there aren't enough healthy ones, your organs and muscles don't get the oxygen they need to function properly. Additionally, cancer cells are metabolically active. They consume large amounts of glucose and other nutrients, essentially stealing energy from the rest of your body. Blood cancers like leukemia disrupt the bone marrow's ability to produce healthy blood cells. Lymphomas can cause enlarged lymph nodes that you might not even feel, but they interfere with your immune system's energy. Solid tumors, particularly in the lung, liver, or kidney, can release substances called cytokines that directly cause fatigue and interfere with normal sleep patterns. If you're experiencing persistent, unexplained fatigue that interferes with your daily activities and doesn't improve with rest, don't accept it's just your age as an answer. Ask your doctor for a complete blood count, CBC, which can detect anemia and blood cell abnormalities, and basic metabolic tests to rule out other causes. Symptom number 5, weight loss without trying. Now you might be thinking, weight loss sounds like a good thing. And for many people who are trying to maintain a healthy weight, losing a few pounds might seem welcome. But we're talking about losing 10 pounds or more over a period of 6 months without any intentional changes to your eating habits or physical activity. This type of weight loss occurs because cancer cells are extremely metabolically active. They consume large amounts of glucose, protein, and other nutrients, essentially hijacking your body's energy supply. Additionally, many cancers release substances that suppress appetite and interfere with your body's ability to absorb nutrients from food. The medical term for this is cancer cachexia, and it's particularly common in pancreatic, lung, stomach, and esophageal cancers. These cancers are notorious for causing weight loss before other symptoms become apparent. The weight loss typically involves both fat and muscle mass, which is why people often notice they feel weaker in addition to weighing less. The biological mechanism behind cancer-related weight loss involves several factors. Cancer cells release inflammatory proteins called cytokines that increase your metabolism, essentially causing your body to burn calories faster than normal. These same substances can suppress your appetite and alter your sense of taste and smell, making food less appealing. Additionally, some cancers interfere with digestion and nutrient absorption, so even if you're eating normally, your body isn't getting the nutrients it needs. The earlier cancer is detected, the more treatment options are available, and the better the outcomes. Don't dismiss unexplained weight loss as a silver lining of aging. It could be your body's way of telling you something serious is happening. Symptom number 4, persistent cough. A cough that lingers for more than 3 weeks, especially if you've never been a smoker or quit years ago, should never be ignored after age 60. But here's what most people don't realize. Lung cancer doesn't just affect longtime smokers. In fact, 20% of people who develop lung cancer have never smoked, and another 50% quit smoking more than 15 years before their diagnosis. We're not talking about the cough from a cold or seasonal allergies that comes and goes. This is a persistent, nagging cough that may start dry and then develop into producing phlegm, sometimes with streaks of blood. The cough might be worse at certain times of day, interrupt your sleep, or be accompanied by chest pain or shortness of breath during normal activities. The reason lung cancer causes a persistent cough is that tumors growing in the airways irritate the bronchial tubes, triggering the body's natural reflex to clear the obstruction. As tumors grow, they can also partially block airways, leading to infections that cause additional coughing and phlegm production. In some cases, tumors press against nerves that control the vocal cords, leading to hoarseness along with the cough. What makes this particularly concerning is that lung cancer symptoms often develop gradually and can mimic less serious conditions. The persistent cough might be accompanied by fatigue, slight shortness of breath, or chest discomfort that people dismiss as being out of shape or stressed. By the time more obvious symptoms like significant weight loss or severe chest pain appear, the cancer is often in advanced stages. The biological explanation involves the location of most lung cancers. About 85% of lung cancers start in the cells lining the bronchi, the large airways leading from the trachea to the lungs. As these cells become cancerous and multiply, they form masses that irritate the airway lining and trigger persistent coughing. The cough reflex is your body's attempt to clear what it perceives as an obstruction or irritant. Here's the critical distinction. A cough from a cold or bronchitis typically improves within 2 to 3 weeks, even if it lingers slightly longer. A cancer-related cough either doesn't improve at all or gets progressively worse over time. It may change character, starting as a dry cough and becoming productive, or vice versa. If you have a cough that has persisted for more than 3 weeks, especially if you're over 60, don't wait for it to go away on its own. This is particularly urgent if the cough is accompanied by blood in your sputum, chest pain, unexplained weight loss, or increasing shortness of breath. A chest X-ray is a simple first step that can detect abnormalities, and if needed, a CT scan can provide more detailed images. Symptom number 3, changes in skin moles or new skin growths. Most people over 60 have various spots, moles, and skin changes that they've learned to live with. Age spots, skin tags, and small growths seem like a natural part of aging. But here's the deadly truth. Skin cancer, including the most dangerous type called melanoma, is increasingly common in people over 60, and the early signs are often dismissed as harmless age-related changes. We're talking about changes in existing moles. If they become asymmetrical, develop irregular borders, change color, grow larger than a pencil eraser, or begin to evolve in appearance. We're also talking about new growths that appear after age 60, especially if they bleed, itch, or don't heal within a few weeks. The reason skin cancer becomes more common with age is cumulative sun exposure. Every sunburn, every day spent outdoors without adequate protection, adds up over decades. The UV radiation damages the DNA in skin cells, and over time, these damaged cells can become cancerous. Additionally, the immune system becomes less effective at detecting and destroying abnormal cells as we age. The medical explanation involves the skin's cellular structure. Melanoma develops in melanocytes, the cells that produce pigment. When UV radiation damages these cells' DNA, they can begin multiplying uncontrollably and spreading to other parts of the body through the lymph system. Basal cell and squamous cell carcinomas develop in different layers of the skin, but follow a similar pattern of DNA damage, leading to uncontrolled cell growth. If you notice any suspicious changes in your skin, don't wait for your next annual checkup. Dermatologists can often determine if a growth is concerning during a brief office visit, and if necessary, perform a simple biopsy to definitively diagnose the problem. When caught early, most skin cancers are completely curable with minor outpatient procedures. Symptom number 2, frequent infections or illnesses. If you're noticed that you're getting sick more often than usual, or that cold and minor infections seem to linger longer and feel more severe than they used to. This could be a warning sign that your immune system is being compromised by an underlying cancer, particularly blood cancers like leukemia or lymphoma. This is about a pattern of frequent infections, recurring sinus infections, bronchitis that keeps coming back, urinary tract infections, or even minor cuts and scrapes that take longer to heal or become infected more easily than they used to. You might also notice that vaccines don't seem to work as well for you, or that you catch every bug that's going around. The medical explanation is that certain cancers, especially blood cancers, directly attack your immune system. Leukemia affects the bone marrow's ability to produce healthy white blood cells, which are your body's primary defense against infection. Lymphoma affects the lymph nodes and lymphatic system, which filter out bacteria and viruses. Even some solid tumors can suppress immune function by releasing substances that interfere with normal immune responses. Here's what makes this particularly insidious. The connection between frequent infections and cancer isn't obvious to most people or even all healthcare providers. Many people, and unfortunately some doctors, attribute increased susceptibility to infections as a normal part of aging. While it's true that immune function declines somewhat with age, dramatic changes in your infection patterns should always be investigated. The biological mechanism involves your white blood cells, which includes several types that work together to fight infections. In leukemia, these cells are either produced in insufficient quantities or are abnormal and don't function properly. In lymphoma, the lymph nodes that normally trap and destroy harmful substances become filled with cancer cells and can't perform their protective function effectively. Early detection of blood cancers has dramatically improved treatment outcomes. Many forms of leukemia and lymphoma that were once considered terminal can now be successfully treated, especially when caught early. Symptom number 1, persistent pain. This is the symptom that delays cancer diagnosis more than any other because it's so easily dismissed as arthritis, muscle strain, or just getting older. But here's the shocking truth. Unexplained pain that seems to migrate from place to place, or deep, aching pain that doesn't respond to over-the-counter pain relievers, can be one of the earliest signs of bone cancer. Cancer that has spread to bones, or even blood cancers affecting the bone marrow. We're talking about pain that's different from typical aches and pains. This is often a deep, gnawing pain that may be worse at night, doesn't improve with rest or typical pain medications like ibuprofen or acetaminophen, and seems to move around your body in ways that don't make anatomical sense. You might feel it in your back one week, your ribs the next, and then in your arms or legs. The reason this happens is that many cancers have a tendency to spread to bones, particularly breast, prostate, lung, kidney, and thyroid cancers. When cancer cells settle in bone tissue, they disrupt the normal balance between bone formation and bone breakdown, causing pain, weakening the bone structure, and sometimes causing fractures with minimal trauma. Additionally, blood cancers like multiple myeloma primarily affect the bone marrow, causing pain as the abnormal cells crowd out normal bone marrow cells. The medical explanation involves how cancer affects bone structure. Normal bone is constantly being broken down and rebuilt in a balanced process. Cancer cells disrupt this balance by releasing substances that either accelerate bone destruction or interfere with bone formation. This creates areas of weakness and triggers pain receptors. Additionally, as tumors grow, they can press against nerves or soft tissues, causing pain that radiates to different areas. Here are the warning signs that pain might be cancer-related. It's worse at night or when you're resting. It doesn't improve with typical arthritis treatments. It seems to move from place to place without a clear pattern. It's accompanied by unexplained fatigue or weight loss, or you experience fractures with minimal trauma, like breaking a rib from coughing or fracturing a bone from a minor fall.